All right, hello everybody. I'm Preston Perez. I'm a third-year medical student at USF, and I'm here at ASTRO 2025 to present my research on the clinical outcomes following bridging radiotherapy in relapsed and refractory multiple myeloma patients prior to CAR T-cell therapy. So we're really looking at ways to boost the outcomes that patients have following their CAR T therapy, and one point of emphasis for us is looking at how we can affect extramedullary disease and drive some better outcomes following their treatment. So we wanted to see if we can evaluate the efficacy and safety of bridging radiotherapy before anti-BCMA CAR T, assess the local control of extramedullary disease, and impact on the survival outcomes. So in this study, we retrospectively reviewed a clinical database at Moffitt of the multiple myeloma patients who received radiotherapy within 90 days of CAR T infusion. And we were looking at factors such as local control, progression-free survival, and overall survival. And here you can see a breakdown of what we found. So we had 19 patients that we identified. 9 received bridging radiotherapy to non-EMD disease, and 10 had it for EMD. And in that, we had subsets. 50% received comprehensive radiotherapy to all sites of extramedullary disease, and 50% received it focally. And you can see the breakdown of median progression-free survival here. Over here for our survival, you can see that the patients with extramedullary disease had a significantly inferior progression-free survival. And going into it further, you can see that comprehensive radiotherapy had a better outcome, and those who received it trended to superior progression-free survival. So overall, we found that radiotherapy prior to CAR T appears to be a safe and tolerable treatment for these multiple myeloma patients with no increased or grade 3 or higher toxicities, and it's associated with inferior clinical outcomes, asking for further research. So this has laid the foundation for a single-arm comprehensive study looking at comprehensive radiation for multiple myeloma patients with extramedullary disease prior to CAR T.